Hi there, my name is Jared. I'm from UCM. I'll be your nursing student today. Can you give me your last name and your date of birth? Okay. What I'm going to be doing today is suctioning out your tracheostomy. Have you ever had that done before? No? Okay, what it is, I'm just going to take a little tube. I'm going to place it down there, down your tracheostomy. I'm going to suction out any secretions or anything down there. Have you been having a little bit of trouble breathing is what I've heard. Your oxygen saturation was about less than 90%, which we don't want to see that. So I'm going to take a quick listen here. Just take a deep breath for me. Let it out. Deep breath. All right. I'm going to double check the doctor's orders here, make sure it's been ordered. And it has. Okay. What I'm going to do is I'm going to wash my hands. I'm going to take my suction and put it on from about 100 to 150. I'm going to take my tube in. I'm going to make sure that it's functioning, which it is. Alright, so now I'm going to go ahead and prepare my suctioning kit. What I have here is just a tracheostomy kit and sterile saline. You got any questions or anything before I continue? No? Alright. I'm going to go ahead and place this over your chest here, just in case anything gets messy. I'm going to go ahead and I'm going to put on some sterile gloves. My hands are considered dirty right here, so I'll stay inside the cup. And I got sterile hand here, so I'm going to keep that on the outside. Outside of the glove, inside of the cup. Alright. Both hands considered sterile right now. What I'm going to do is I'm going to go ahead and dirty this hand here by getting my oxygen tubing. Once again, I'm going to double check, make sure that it's functioning. It is. I'm going to take these two and connect. Again, I'm going to double check, make sure it's working. I'm going to take my kit here. I'm going to lubricate it. Again, checking with suction, intermittent suction on that. Alright, and then from here, what I'm going to do is I'm going to hyperventilate my patient with my ambu bag. What it is I'm going to do 3 to 6 quick breaths, and what this does is this prevents hypoxia during the procedure. So, there we go. And now I'm going to go ahead and start with the suctioning procedure.
Alright, now I'll be inserting the catheter into the tracheostomy. I'll be inserting quickly but gently, and until I reach the predetermined length, or I hit resistance, then I'll pull back about 1/2 inch. And as I pull back, I'm going to intermittently suction as I twist. And the twisting prevents irritation on the mucosa. Alright. You don't want to suction any longer than 10 to 15 seconds. And now that I'm done, I'm going to assess the patient, encourage him to cough and deep breathe. My assessment will determine whether I need to do another pass with the suctioning or not, and according to this patient, I'm going to have to do another suctioning. What I'm going to do is clear out the catheter as I include the white port and the normal saline. Before I do another pass, I'm going to have to wait 30 seconds to a minute, and then I'll hyperventilate them again. And then the same procedure. Alright, and then reassess the patient. They're in good shape, it looks like, so I'll start cleaning up my equipment. Put the gloves in the trash. wash my hands. Alright, now I'm going to reassess the patient again. I'm going to check for difficulty in breathing, lung sounds, O2 saturation, and the outcomes will be met once all that's back to normal. No difficulty breathing, no shortness of breath, O2's up. All right, how are you doing? Do you need help with anything else? All right, I will let you relax then. Hey Jared, well, now that we're done talking about the tracheostomy suctioning, I got a few more questions that we need to answer before we end our show.
Well, that sounds good, Will.
Well, I'll start off with the first question. What would you do for a post-op patient before you start tracheal suctioning?
Well, Will, for a post-operative patient, it's important to administer the medication that was prescribed before you begin the suction. Well, I have a question for you, Will. What PPE would you use during a tracheostomy suction?
What you're going to want to do is use standard precautions, and plus you're going to want to use a face shield or goggles and mask to prevent any droplets from getting into your eyes or mucosa.
Well, golly, that's right, Will.
Well, good deal, Jared. Well, can you tell me some important concepts to remember while suctioning?
Well, Will, some important concepts to remember is don't suction for more than 10 to 15 seconds. And while inserting the catheter, make sure you don't occlude the Y port.
Yeah, Jared, that's correct.
Well, Will, I have a question for you. What are some important things you need to document after suctioning the patient's tracheostomy?
Well, Jared, the important things to document after the procedure are lung sounds, the amount and characteristic of the fluid that was suctioned, the respiration rate, the O2, the catheter size, and the time the procedure was done. And then after all that, don't forget to sign it.
Well, man, Will, that's right.
All right, well, Jared, can you tell me what you would do if lung sounds don't improve greatly and the oxygen saturation still remains low after you suction 3 times?
Well, Will, that's an important question. Make sure you reassess the patient. Make sure you allow the patient time to recover from the previous suctioning. If you need to resuction the patient, make sure that you hyperoxygenate the patient again, and then suction the patient again, and assess whether their oxygen saturation has increased, their lung sounds has improved, and their suction amount has decreased.
Good job, Jerry. That's right.
Well, Will, those were all important questions. Thanks for taking time to talk about it.